Hi, welcome. Let's continue to talk about this question for USMLE Step 1. Which of the following patients is most likely to have symptoms of the carcinoid syndrome? Carcinoid syndrome. As we know that carcinoid syndrome is only result from 10% of the carcinoid tumor. Please remember this, carcinoid tumor. Why? Since most of the carcinoma tumor will have the neuroendocrine secretion characteristics, that's to say, they will secrete substances like serotonin, right, and gastrin, okay, gastrin or vasoactive intestinal peptide, etc., or somatostatin, right? Somatostatin. And there's a drug called octreotide. It's kind of the somatostatin analog, right? But please remember that this carcinoid tumor secretions will flow with the blood from the gastrointestines, and to the portal vein, portal vein of the liver, right? Portal vein of the liver. As we know that liver will clear the most of the toxins, including this kind the secreted substances. So, if there's no lesion on the liver, or if there's just a very small part of the lesion on the liver, these substances cannot flow fully into the blood vessel, present the carcinoid syndrome, right? As we know that carcinoid syndrome, there's like a flushing face, right? Or flushing face, or red face, right? And there's a diarrhea, right? And there's some right heart failure, right? Right heart failure. The right heart failure is because the serotonin lead to the fibrosis of the endometrium of the right heart, and then the right valve of the heart will be injured, and then there's the clinical manifestation of the heart failure, right? And also there's some wheezing or apnea, right? Or dyspnea, or wheezing, right? Or asthma symptoms, right? So this is the carcinoid syndrome, but there's only 10% of the carcinoid tumor, because the blood from the intestines, from appendix will pass by the portal vein and get into the liver for the further metastasis or metabolism, from further metabolism. But unfortunately, most of them, the substance will be degenerated, be degraded, right? So only 10%. But this carcinoid tumor, if unfortunately happen on the chest cavity, or the retroperitoneal carcinoid tumor, and the blood from this kind of tumor will not bypass the liver, and then can directly get into the circulation of the blood, and then it will have the carcinoid syndrome, right? Okay, please remember this. So let's just check the choices one by one. So choice A, patient with a carcinoid tumor localized in the appendix. So as we know that appendix is part of the large intestine at the end of the colon, right? And then the blood will, from the appendix, will bypass the portal vein, and then so the patient cannot have or less have the possibility to have the carcinoid syndrome, right? Choice B, patient with carcinoid tumor of the small intestine, certainly the substances in the blood will bypass the portal vein, and only the 3 centimeter nodule in the liver seen on the CT scan. See that the 3 centimeter nodule is not large mass in the liver that can be seen on a CT scan. So that's to say the liver still have the function to clear this the substances, secreted substances such as serotonin, gastrin, vasoactive intestinal peptide, or somatostatin, and then it will not have the carcinoid syndrome. So A and B out. C, patient with an apple core lesion seen on the Barian enema. As we know that the Barian enema is a diagnostic way, a measure to check the large intestine adenocarcinoma, right? It is for adenocarcinoma of large intestine or intestine, right? Intestine. But as we know that the blood from the intestine will flow through will bypass the portal vein, and the substance will be cleared by the liver. So choice C out too. Choice D, patient with adrenal mass, elevated level of the urinary vanillin mandelic acid, briefly VMA. Well, VMA is associated with adrenaline or noradrenaline metabolism. And both of them is associated with the pheochromocytoma. Okay, so the associated with a tumor called chromocytoma. And then, as we know, that pheochromocytoma will not have the clinical manifestation or symptoms of the carcinoid syndrome, right? So D is out. Last, patient with retroperitoneal carcinoid tumor. Retro means back. Peritoneal is back of the peritoneal. And as we know that back the carcinoid tumor located on the retroperitoneum, the blood will bypass the portal vein and then directly get into the blood circulation, and then it will probably have the carcinoid syndrome, right? So choice E is the correct choice. Okay, is the correct choice. So just remember that most of the carcinoid tumor secreted the substances of serotonin, gastrin, VIP, somatostatin, etc. They will bypass the portal vein, and in the end, it will be cleared by the liver if the liver is in function. That's to say, only 10% of the carcinoid tumor will have the symptoms of the carcinoid syndrome. But for these questions, the choice E, patient with the retroperitoneal carcinoid tumor, because the carcinoid tumor is located in the back of the peritoneal, that will directly get into the main circulation of the blood, getting the abdominal, the artery system, right? And then it will easily the secreted substances like serotonin, gastrin, VIP, somatostatin will flow inside into the blood circulation, and then have the symptoms of the carcinoid syndrome, such as flushing face, diarrhea, right heart failure, dyspnea, wheezing, or asthma-like symptoms. So, well, that's for this edition of the USMLE about the topic of carcinoid syndrome. Thank you for being with me. Bye-bye.